Now, what else differential we should be keeping in mind is one of the other non-mechanical causes is inflammatory arthritis of the hip joint. This could be rheumatoid arthritis or it could be psoriatic arthritis as well. Whenever you are, first of all, we would have a history of this sort of a problem. Patient may be taking some form of a treatment in form of steroids as well for that. Therefore, once if the patient has history of RA and there is taking steroid, then the first thing you should go for is that there may be associated AVN of the hip leading to hip joint osteoarthritis. But usually our history was that he was having a problem on one side. Patient with these sort of problems usually have a bilateral disease. There's less likely, there may be increased pain on one side, but usually they involve both sides. And most of the time they have pain which is more so on one side, but they have a bilateral pain, history of pain. For example, if you see x-rays, or this is x-ray pelvis view, AP view, can you appreciate there is actually periarticular osteopenia, increased sclerosis, there is periarticular cyst as well, and this is a bilateral disease. Now this can lead, this could be rheumatoid arthritis, this could be psoriatic arthritis, this could be other inflammatory non-rheumatoid arthritis as well, and therefore you have to rule out all these pathologies in your history as well as your clinical exam before going on towards your radiological investigation.